I'm Amie Meditz. Welcome to our home. I'm an infectious disease physician at Boulder Community Health. Many people have asked me over the years, what does an infectious disease doctor do? It's a popular cocktail party question. And we take care of people with all kinds of infectious diseases. And recently, we've been taking care of people with COVID-19. We also play an important role for the hospital as well. We work with a lot of different people at the hospital, as well as the health department, to ensure the safety of our patients and staff by helping hospitals to develop, our hospital specifically, to develop protocols and treatment plans based on evolving data that helps us respond to the pandemic. I want to admit something here. Even with all of my training, I had not recognized the likelihood of a pandemic and the importance of preparedness as a country and locally. It's a really positive effect that this pandemic has had is that we are way more prepared now. The preparedness of our hospital has increased immensely. More safety measures, plans to increase the size of our hospital or the number of beds there, not the size, but the number of beds, the number of ventilators. So things have greatly improved, and this was the result of a lot of teamwork at our hospital. And really, I honestly feel that our hospital has never been safer. A lot of our employees come up to me and they say to me, I mean, other than being home, I feel like I'm safer here than anywhere else. And that really is so important to us. The other question that I'm often asked by patients and friends is, what can I do to stay safe and well? I'm not here to tell you something that you probably already haven't heard. I'm here to act as a coach, to stress the importance of continuing to do these things. These measures include wearing a mask, maintaining 6 feet of distance from others, and only go to small groups that are able to be distanced in the outdoors, and hand hygiene and avoiding touching your face. Those 3 pillars are the most important things that we're doing. I want to talk a little bit more about masks. Here's another truth. If you asked me a year ago, whether the transmission of a respiratory virus by an entire community wearing a mask would prevent this transmission, I probably would have stuttered something non-committal, honestly. But what we've recognized with this pandemic through scientific data, that an entire community wearing a mask prevents transmission of a respiratory virus. And why is this? This virus is spread by droplets. These droplets are right now being emitted from my mouth. They're emitted with talking, breathing, coughing, sneezing, and wearing a mask basically prevents the escape of these droplets and prevents infection from spreading from you. Since masks are the most visible component of our global prevention plan, it's been remarkable to me how our community has stepped up and taken personal responsibility and worn masks. This, we believe at Boulder Community, has greatly mitigated our local outbreak, and we are so grateful to our community. But we cannot stop now. We cannot stop now. Wearing a mask is not enough. We have to keep distancing ourselves from each other to avoid close contact of groups. Luckily, we live in an area where there is plenty of space and outside distance, where you can be distanced. I want to explain continued physical distancing of an entire population and why that is necessary. This is a new infection for our bodies, and we have no immunity. This infection is transmitted not only in people who have symptoms, but people who don't have symptoms or maybe just about to get symptoms. And the virus is highly contagious. It's had a significant death toll in the United States and worldwide. So we have to remain separated. Distancing ourselves has become increasingly difficult for everyone with time. It's hard not to be able to do the activities we enjoy with friends and family. In fact, the ID team at Boulder Community recommends indoor dining and indoor gyms to not be that safe. It's in our nature to socialize, and some of our feelings of frustration, sadness, loneliness are expected. I've had lots of patients tell me this, and so I deem it common. I myself feel this way sometimes. I've not been able to see my parents since the beginning of this year, and I typically see them every 3 months. It's been really hard, and other people have had much greater hardships. It's important to reach out to your primary care or other resources if feelings of hopelessness become uncontrollable. How do I combat these feelings? Well, I wear fun masks, which I consider the new accessory. One of my masks says howdy on it. I keep in touch via FaceTime and phone. And as you can see, I like to dress up or wear a fun hat. I love to be outdoors, distance, of course. And I really like to be kind to people on the trails. Many people are sometimes surprised. No matter who they are or what they're doing, I'm kind. I want to be kind. Although we haven't been overwhelmed at Boulder Community to date, we're not out of the woods, and I don't know when we're going to be. I would recommend to everyone that when you're in public, think of yourself as possibly infected with COVID-19, even if you feel fine. It's important to continue the measures of masking, distancing, and hand hygiene to limit community spread and resultant unnecessary deaths. I really appreciate everybody's time today. Thank you for your attention.